Fambuluna Adu, me na Dr. Francis Hui, me na Dr. Fodembele Umandem and the Uman Siklem. Today we can talk to one about fibroids and other growth which can happen inside woman in womb. Mostly then growth here so can happen during the reproductive years, then at the 10-day way woman likely forgets belly and for born pekin. And not all man will get fibroid who actually know say he gets fibroid. Most times person they can hospital for absolutely different thing and then do a scan and then find out say, oh, you get a fibroid. So it means to say not all fibroid will come with certain symptoms then. Most women the way they get symptoms can usually come with maybe they get pain in belly, depending on the size of the fibroid, maybe they press pain, bowels there, they will get constipation, something in there, you go to find that difficult for wet or you go to wet fast, again depending on the size. So women and they can come with heavy bleeding. So you can find out say during in period they bleed boku or wait in period on done they bleed in between, waiting we call intermenstrual bleeding. So woman and they can get pain during mommy and daddy business as well. And then pelvic pressure, like for say something they press down by you, especially if this fibroid big. But some women and they, as I mentioned, they get any symptoms and are only when they can at hospital, then do a scan and then find out say they actually get a fibroid. The location of this fibroid inside the womb, it can vary. Sometimes they are the beef part of the womb, sometimes they are the covering part of the womb, sometimes they inside. Outside picking the dome, outside period they come out. Mostly the one and then they can cause heavy bleeding. But fibroid any side, including even the one waking day, now the neck of the womb, what they call the cervix, all of that and they can cause bleeding in woman them as well. Now, mostly people that get fibroid, the first thing we remember is me and the bone. One of the reasons for doing this video now for we just know say it depends on the location of the fibroid. For you able to get belly, you will find out say your cervix need for open because the sperm need for go inside your cervix, need to your tubes for fender egg day. So as long as the fibroid not really they unbog the pathway, getting pregnant may not be the issue. The issue probably now with regards to staying pregnant, because sometimes the fibroid can increase in size for women then we get belly. So people can say, well, why make what's not the reason why make me get fibroid? Maybe this not get a fibroid or that person not get fibroid. We get certain things that we consider as risk factors. We as black women them definitely they at risk of getting fibroids, and we usually are at a younger age and with really bad of symptoms them. It's different from people that we not to black person. But also heredity, genetics. If your mama don't get them before or your sister don't get them before, there is a good chance say you self go get a fibroid. Not so like for say pauper you go get them, but it just means to say the risks higher. If you get your period earlier, there is a chance again because of the chemical and the way they release earlier in your body, you would get a higher chance for get fibroid. Same way if you overweight, same way if you they eat certain foods we not get enough vegetables, we not get enough vitamins, especially for vitamin D, there is a risk say you could get fibroid. But again, those are risk factors, and what would they camp and prevention? Mostly the idea is how for make sure say your lifestyle, as in what you eat, the exercise what you do, you make sure say you do things then we go reduce the risk of getting fibroid. But reducing the risk again not mean to say you not go get fibroid at all. One of the things that we can worry about with company complication of fibroid is obviously bleeding, because if you dey bleed boku, it means to say you dey at a risk of anemia, which means to say your blood level low. And if your blood level low, this now where your heart they beat fast, this now where you will feel like dizzy and you aid the turn by you. Something that you need for admit for blood transfusion, then they self get in your complication, then they self get in your risk. You know, infertility, especially if it dey inside the womb where they block that passage of the man's sperm, the man's water for go fend that egg. So that is also an important complication of people that will get fibroid, for people that will get fibroid, especially big fibroids. If you don't get the belly, Again, depending on the location of the fibroid, as I don't explain, the chemical the way your body they produce during the belly, then chemical they can get the tendency for feed the fibroid and make it grow. So you will find out say woman they will get big fibroid and get belly, then they are at risk of miscarriage, then they are at risk for letting the pikin not grow fine, what we call growth restriction, then they are at risk for maybe like a preterm labor, like the pikin they did it take full 9 months, because as the fibroid they big, the pikin they big, as the pikin they big, the fibroid they big, so then they compete for space as well. I always they preach say woman and them for know waiting they happen at them body, so that you see anything different now you could be the first person for Kana hospital. So if you see that belly they big, it not mean to say that belly you get, especially if you they miss your period, because we don't get situations like that. If finally be like say you able for those scan, let you know waiting they happen. And a sister gets a fibroid I get, whatever not the case for you at that particular time day. Something and they we can able for use medication depending on the size of the fibroid for relieve some of the symptoms there. So we get, if you get at a particular age, certain medications then they will we go use, we go tend for shrink the size of the fibroid. Something and they surgery is needed. The surgery na either follow we go pull the fibroid or follow we pull the entire womb, depending on the stage of your reproductive life, depending on the symptoms the way you they present with. All of that then are something where you go discuss with you and your doctor. Remember say obviously we they preach say the hospital na you party, we they preach say not or something where I don't get patients the way they come and say, then say I take this medicine, this tablet here so it will shrink the fibroid, then say I take this country medicine, it will shrink the fibroid. I beg, if finally you able for see a doctor, we go able for go through all of your documents, we go able for do scan for you, we go able for examine you properly, give you a diagnosis and formulate a management plan. This not a situation where you go drink medicine, this not a situation where you go to that mommy or that pana corner. This not something we need in hospital care. Till next time, me and Dr. Frances Wade, I wish you all a happy and a healthy